Today on Veterans Stand Up, we're talking about the benefits and support provided for veterans in the state of Texas. And I'm talking with Tom Palladino, the executive director of the Texas Veteran Commission, which is the state agency charged with advocating for and supporting veterans in the state of Texas. So welcome, Tom.
Welcome, Paul. Thank you for having me on your show.
States provide a range of benefits, and I think Texas is regarded by many as the gold standards because of the different benefits they provide to their veterans. What are some of the key benefits that differentiates the approach in Texas?
So in Texas, the legislature and the governor and lieutenant governor have always been very supportive of veterans in Texas and of providing funding and programs to state agencies to support that. So we're the Texas Veterans Commission, with the State Department of Veteran Affairs. Like every state has a similar department. And, we've been given resources to serve veterans and their families and survivors, and to ensure that they have access to the benefits and services that they're entitled to. So in Texas, over the years, the legislature has given us some additional tools to help veterans. And some other states have some similar things, but we have some particular things that are unique to us. So we do have disability claims benefit advisors that file disability claims for veterans. They're embedded in VA hospitals, embedded in VA outpatient clinics. They are on military installations as well as the regional offices. And not every state does that. And so when they're there where the veterans are, so that they can talk to the veterans, and they can also file claims on their behalf. Additionally, they can do it electronically. So the one good thing from the pandemic is that we can serve veterans in person, but we can do it remotely. And we can make appointments on our website. So a veteran can make their appointment on the website, and they can do the entire disability claim online with our benefit advisor if they so choose. But if they want to be seen in person, they can do that as well. And then that, of course, extended to all our other services, in the agency. So it really has made us versatile in serving veterans. And we do it after hours as well. Right. And so I think it has really helped us serve those veterans, especially the ones that can't travel as much. We have a healthcare advocacy department the legislature created for us in 2015. And that is to specifically help veterans navigate VA healthcare issues. So they're embedded in VA outpatient clinics and hospitals. And we have an MOU with the VHA to make sure that they're all in there and they get proper support. And they then advocate for the veteran. They represent the veteran with the VHA and getting their appointments and getting their prescriptions and their quality of service and any issues that they have. And I think we're the only state that has something like that. It's a great program. They help thousands of veterans navigate the intricacies of VA healthcare and their appointments, and also the community providers, through the care program. We have an employment program. Department of Labor has a veteran employment program that they fund grants to the states to have veteran employment representatives help veterans on the ground, transitioning service members, veterans with significant barriers to employment, to help them with their job skills and work with employers to hire veterans. In every state except ours, it's in the workforce agency, and it's not always one of their main programs. So in our state, we call it the Texas model. It is in our veterans agency, and we give them all the support that they need. They work with the workforce employment boards across the state, and they work with our workforce agency partners. And but we can really ensure that program's making a difference. And they're spread out in 75 cities in the state, and so they do a great job. We have a veteran education program that manages the GI Bill throughout the state with all the schools that use the GI Bill, but they also manage a state education benefit. There's a state education benefit in Texas. It's called the Hazelwood program, Hazelwood exemption. If you're a veteran that ended service in Texas and you served at least 180 days on active duty and you still reside in Texas, you're eligible for 150 hours of exempted tuition at any public university. And if you don't use it, you could pass it on to one of your children. But you have to use that in conjunction with the GI Bill. So the GI Bill has to be used first. But it's a great state education benefit. We also have a veteran entrepreneur program. We can help veterans start and maintain their own businesses and get exempted from franchise taxes. We have a women veterans program, the first women veterans program in the nation, where they focus specifically for women veterans that are here, which, by the way, we have the most women veterans in the country, over 200,000. And we just passed California in how many veterans we have in the state. A little over, it's 1.5 million. It's a little bit higher than California. Then we have a mental health, a veteran mental health program. It's a great program. We've had it now for a few years. And they then focus in on resources for veterans to get them into those resources, whether they want to talk to a military veteran peer coordinator around the state. We have 40 of them around the state and local mental health authorities, or clinical counseling. And then they are also focusing on homeless veterans and justice of all veterans with all the veteran treatment courts. We have 40 veteran treatment courts in Texas, and we work with incarcerated veterans to help them with their benefits and their transition into society. And then lastly, we have a grant program, which is a very large fund for veteran assistance. There's a veteran cash ticket as part of our lottery commission. It's a $2 ticket. It generates $30 million a year. So our commissioners award $30 million to nonprofits and counties in order to provide service to veterans. General assistance, like emergency financial assistance, supportive services, transportation, to mental health grants, to housing, like renovating homes for disabled veterans, to veteran treatment courts, to county veteran service officer grants. So that's just a quick overview of the services we provide. And then, of course, some of the other agencies in the state also have additional services.
Now, I know in terms of finding out more, I'm assuming you'll say, hey, go to the website, and you can mention that. But also tell us about the Texas Network, if I understand, the Texas Veteran Network, if I understand that.
So, right. So we do have a website, of course, that you can go online, get all your services. You can actually fill out a form to get an appointment. And then you'll get called back, and then we can set an actual appointment with you. But we also have a statewide referral network. And the statewide referral network, excuse me, sorry. The statewide referral network is called the Texas Veterans Network. And the Texas Veterans Network is a statewide database that providers of services, a lot of nonprofits in county, local government, and state government, they put their services in there. A veteran then can sign up free of charge. All of this is free of charge. And they could actually have a profile in there, and they ask for services. And then those organizations will then reach out to them. And they can also reach out to those organizations in there. And it's awareness and a way to link between one organization to another. So if one organization is providing a service like disability claims, but you want you want legal assistance, right? Or you want, transportation assistance, or you need something to do with, you're renovating your home, or financial assistance, or mental health. There's a lot of organizations out there that do that, and you'll be able to get connected with them through this Veterans Network.
Oh, that's great. Thank you, Tom. Thank you very much.
You're welcome.